respected brothers, and we have few sisters. Uh, Despite of the weather, a lot of brothers have joined, and I think some other brothers will join us. Uh, Respected brothers, we have a very important seminar on lung cancer and cancer-related other diseases. And we have a very renowned specialist joining us today from Northwell Jewish Hospital, Forest Hills, and he's Dr. Abhishek. And we have with us from Northwell Forest Hills, my good friend, community outreach, Stancy Saji. She's the manager and the community relation. And also we are joined by No, you're going to come in 5 minutes. I lost this card. He gave me this card. I misplaced my card. All right, I'm sorry. I'm going to introduce him. I misplaced his card, but at this time, to welcome you all, I'm going to request our General Secretary, Brother Aftab Mannan, to welcome you all.
Auzu billahi minash shaitanir rajim. Respected brothers and sisters, I welcome you all for very important seminar today. You know, as I mentioned before, in America, every year, over 1.9 million diagnosed cancer. Over 600,000 people die every year. So it's very important seminar. I thank all the organizers, especially Dr. Shachi, and for organizing these seminars. Without further delay, I'd like to call the stage our trustee chairman, Dr. Nazmul Khan, to give the welcome address. Please, Dr. Nazmul Khan.
Assalamu alaikum, brothers. I don't think we need that many introduction. Lung cancer, as you know, is one of the most difficult cancer and most common cancer in this country, in the Western world, even in our countries. You have heard, I'm sure each of you have at least somebody that you know who had a lung cancer, and it's a very bad cancer. As a doctor, I know that very well. And we are fortunate to have Dr. Abhishek. He's a cancer specialist, and I'm sure he will shed a lot of lights. A good thing is that he's not going to speak in English alone. He can speak Bengali also, but not as good. So please don't push him too far and too hard. He will do in between Bengali and English. Okay. Okay. Thank you, Dr. Abhishek.
Thank you, Dr. Nazmul Khan, Chairman of JMC Board of Trustees. Just very briefly, my good friend and coordinator of this event from Northwell Forest Hills Jewish Hospital, the community relation manager, Stancy Saji. And why am I keep forgetting him? I'm sorry. I just also wanted to acknowledge George Cruz, and he's the Assistant Vice President of the operation in Northwell Health Cancer Institute. Thank you so much, Mr. George Cruz. Thank you.
Thank you, Dalbar. Hi, everyone. Good evening. Assalamu alaikum. My name is Stancy Saji. I'm a program manager for LIJ Forest Hills. Thank you so much for having us here for this very important talk that's going to be led by Dr. Abhishek Sweka. He's our medical director of the Rego Park Cancer Center. So I really appreciate you all investing some time to really learn about lung cancer, its symptoms, screening. It's very important for the community. So with that being said, I'm going to call up Dr. Sweka to deliver this talk.
Thank you, guys. Well, welcome. Again, if I don't interfere with your food, but So, Abhishek Swaika, actually I can speak Bengali too. So, আমি একটু বাংলা বলতে পারি. Not a lot, but just enough to have a conversation here in Queens. Just a background that we were part of Queens Medical Associates, which were in Dr. Khan, as he said, was in Fresh Meadows, but now we became part of Northwell for the last 4 years. It's been a great collaboration, and we moved to Rego Park in 9525 Queens Boulevard, and we primarily do a lot of things at Forest Hills Hospital. That's where I'm the division chief for oncology as well as Rego Park. So we'll just briefly talk about lung cancer, and then I'll take as many questions, and I'll try to answer some of them in Bengali. So the goals are review the benefits of lung cancer screening. So instead of going to the details of the treatment options and the paradigm shifts which happen every day, I'll talk more about preventing or at least screening for lung cancer. We discuss the risk factors and then some common questions, and I'll try to keep it brief. George, next slide. So lungs, as we know, the organs very important for our breathing, and smoking is the #1 problem, which causes cancer, but also just COPD to begin with. There are small alveoli, which is where the oxygenation happens, the exchange of oxygen from lungs into the blood happen, and that's where the cancer originates. Next slide. Cancer again starts in the lung, and it takes sometimes long time to develop the cancer. There are two different kinds. One is non-small cell lung cancer, and one is small cell lung cancer. There is a differentiation because the prognosis and the treatment options are completely different. Go back to one slide, George. The reason I bring this up is small cell cancer, which are 10 to 15% of the cases, are mostly and primarily in patients who are smokers. And they are the worst prognosis. So people who smoke get that kind of cancer more. In non-small cell, majority is cancer with smoking, 80%, but there are other cases which are not smokers. So I have many patients who are women. Mohila deke also hote pare eta, keno ki ora, even if they don't smoke, jodi ora smoke na kore, takhono lung cancer hote pare. So that, I have patients like that, and they are treated differently. We can actually give them pills to treat cancer. Believe it or not, and that's completely different. So I wanted to bring that distinction for these two kind of cancers. Go ahead, George. Lung cancer is the second most common cancer in both men and women, but is the leading cause of cancer deaths in the United States. So I will let that sit for 1 minute. Just think about that. It's the most common leading cause of cancer deaths in the United States, as we were just talking about this briefly. It's most often diagnosed in older people, but can be diagnosed in adults any age. And younger patients, we are seeing that even without non-smoking, those patients we pick up, and they're younger generally. As we know from the science, there are new mutations which trigger the lung cancer. 8 of 10 cases and deaths from lung cancer are in people who smoke or have smoked in the past. So again, I'm going to be talking a lot about smoking, just because so that we can prevent this from happening in the first place. People who never smoke can also get lung cancer, as we spoke about. Again, if you look at this graph, I'll let it sit again. This is what it shows, that look at the death from the lung cancer perspective. Each red line in both slides show that the lung cancer is the leading cause of death, even when you compare with other things. And this is where screening becomes important. Jodi amra otake age dhorte pari, then we can treat it. And I'll show you in the next slide why that's important. Just symptoms of lung cancer, but the most important part is the second line. The goal is early detection. If you detect the disease early, you can actually treat it much better. You can actually cure it. We can try to cure it. And I'll show you the numbers. This is a very easy test. The lung cancer screening is actually, you go in a CAT scan, or a daina, they don't give you anything IV or PL or pills, no IV. Apni jaan, apni ekta CAT scan, it takes 2 minutes, it goes round. I know some people are scared of going inside the machine, but it's very quick and brief, and then they can pick it up. A screening, and they have it all around the United States, and Northwell, as well as people in New York. It's very easy access, and insurance covers it. So people who have smoking history, they should get the screening. And we'll tell you the criteria of what is covered by insurance and not. But this is the most important part. Look at the 5-year relative survival. মানে যদি কাউকে cancer হয়, then what is the chance of them being alive at 5 years? This is a little bit of an old data, but still, very important. Look at the localized. Mane jodi, if you pick up the cancer early, the 60% chance of people being alive at 5 years as opposed to 7% chance, even with all the new treatment options that we have in the distant or stage 4 cancer. Mane jodi stage 4 hoye jaye, then 5 chance of people being alive, patient being alive at 5 years is only 7%. Now, we have newer treatments which are changing that paradigm, it's changing the prognosis, but it's still, that's something to keep in mind. And that's why the lung cancer screening becomes important. You pick it up early, you try to treat it right away. And then again, this is the stage distribution, same thing, same highlight. George, next slide. This is the criteria, which is, when you see your primary doc, when you talk to us for any other reasons, this is the criteria. The updated 2021 guideline is if anyone is between age 50 to 80 and has smoked 20 pack years. Now again, pack years are different. Jodi apni ek pack cigarette smoke karen for 20 years, that becomes 20 pack year. But somebody says, I only smoke 10 cigarettes a day. So if you smoke, that's half a pack, at least in America. I know in India and Bangladesh, it's 1 pack is 10 cigarettes, but here is 20 cigarettes. So the guidelines are ekhan theke 20 cigarettes. So if you smoke 10 cigarettes, that's half a pack, for 40 years, that's 20 pack years. So you will qualify for getting the screening. The other thing is, anyone current smoker or quit less than 15 years, they still qualify. So let's say apni 55 and apni 20 pack year smoke korechen, kintu you quit at 45. You still qualify because the risk of having cancer is still high. So you still get the CAT scan done. And then there are some exclusion, somebody who's 85 years old or 80 years old and have other comorbidities, diabetes, other things, and can't get treatment, that's a different story. But majority of them do qualify. George, next slide, please. So, individuals at risk of, they should talk to their primary care. I won't belabor this point, but this is what I was trying to ask about doing the guidelines. Go ahead, George, next slide. Okay, very important, annual screening with CT chest. Mane, this is covered by insurance. Eta insurance korbe. Jodi apni bolen or apnar physician bolen ki, yes, you qualify, apni smoke korechen, apna eta, a CAT scan ta insurance will cover. So, again, the guidelines are age 50 to 80, aage chilo 50 to 55 to 70, but they expanded it to 50 to 80, 20 pack year smoking history, current smoker or quit 15 years ago. And for Medicare, it's 50 to 77. I mean, 3 years is not a big deal, but majority of people do fall in that. So this is a very important guideline and most docs already use it, but we actually, encourage patients to get the screening done. And then I have ordered it many times for patients who come in for other reasons, and we have picked up early stage tumors, and then we can cure them. Think about it. If you pick up the cancer at an early stage, 1, 2, we can actually try to cure it rather than, let it sit there and become stage 4. So again, this is the math for the smoking, about 1 pack money, 20 cigarettes for 20 cigarettes every day for 20 years. That's 20 pack years. But you said I actually smoke 2 packs a day, 40 cigarettes a day. I have patients who smoke 3 packs a day. I don't know how they find time for this, but they do. So they smoke, and then if you only do that for 10 years, 2 packs, then it becomes 20 pack years. So it doesn't have to be 20 bochor, it could be 10 bochor, 30 bochor, depending on how many cigarettes you actually smoke. Okay? Next slide, George, thanks. And then these are the common risk factors for lung cancer. So, occupation, I don't think we have this problem in New York, but in other places, miners, heavy metal workers, and etc. Or your past history, if you came from somewhere else and you had, such exposures early on in your life, then that is a risk factor. But smoking tobacco is the number 1. The other thing is secondhand smoke is also important. Jodi apni body te cigarette smoke koren, and then, your other kids or wife or other people get exposed to, that becomes a risk factor too. Family history, if it runs in family, the non-smoking one can also increase the risk of cancer. Dietary factors, we know if you eat unhealthy food. Radon gas is very common, but not in New York City as such, but outside. Or rock theke ja gas beroy, that is actually common to have cancer. That has been shown. Aging, illnesses, tuberculosis, COPD, pollution, well, that's in New York City, but it's still better than elsewhere. And then exposure to radiation. Again, less risk factors, but these are all the risk factors. যখন আমি patient দেখি ওরা আমাকে জিজ্ঞেস করে আমাকে কেন হলো যারা smoke করে, they already know that that's the leading cause, but there are other reasons as well, including the family history of cancer for getting lung cancer. Okay, smoking leading cause of lung cancer. 80% of the lung cancer deaths are linked to smoking, and also যারা smoke করে, their tolerability to have the treatment is also reduced because that becomes a challenge too. And then, it causes other problems, genetics, and just getting through the treatment itself. A lot of patients jara amake dekhe ora smoking quit kore deয়. It's too late, went on treatment, but still better than continue to smoke during the treatment as well. Next slide. Benefits of this is an important slide. So I want you to take this. If anybody's smoking, if you quit 20 minutes after quitting of smoking, the heart rate and the blood pressure drop back to normal. Think about that. If it goes to 2 weeks, 1 year, 10 years, after 1 year of quitting, the risk of heart disease is reduced by 50%. I mean, think about like how when you quit smoking, what happens. And then at 10 years, the risk of dying from lung cancer drops to 50%. And at 15 years, the risk of heart disease equivalent to a non-smoker. This is the reason why the guidelines have that in the screening of the 10 years and the 15 years after smoking cessation. Screening does not replace smoking cessation, obviously. If you still smoke, you should get help, and there are 2 ways to do this. You could call the Northwell Health Center for Tobacco Control. At that number, we'll give you the flyer. Or the other is the New York Quits. I have many patients, আমার অনেক patient আছে যারা a phone, দুটো phone করে, they need help, they need counseling, or just to keep going on talking about the same thing, and that helps quit smoking. Again, lowering risk is talk with your doctor, exposure, the healthy diet, smoking, lung cancer, and then, there are other patients, even no risk factor, still get cancer. It's very common in the Asian population. 23%, mane 1 in 4 in the Asian population actually have cancer which is not related to smoking. So even though we talked about smoking a lot, there are still patients who never smoked in their life can still get cancer. So, and then we can treat them as well. But, just to say keep smoking does not cause all cancer. There are 23% of cases where without smoking it also causes cancer. Okay, this was more screening, but let's say we have cancer, right? There are different stages of cancer and then different treatment options. If it's picked up in an early stage, so stage 1, there are 4 stages, 1, 2, 3, and 4. If it's picked up in an early stage like 1 or 2, we can still cure you, even with 3. It's just that the more it advances, the risk of recurrence and death becomes higher and higher. 1 and 2 generally require surgery. After 1A, everybody generally needs chemotherapy or immunotherapy. And what TKIs are pills. People find it hard to believe when I say that we can treat stage 4 lung cancer with a pill. I have so many patients and such good stories where they are alive 5, 6, 7 years, but those are non-smokers patients, those are treated with pills. Apart from that, we do surgery, radiation, and then at Northwell, we have a lot of clinical trials. Mane investigational agent, ja age chilo na, 2015 er age, we did not have immunotherapy for lung cancer. It took 20 years to develop immunotherapy in Texas and other places to bring it. And since we have it, it's changed the treatment paradigm. Patients are living longer, they're tolerating the treatment better, and that's because of the research. So in order to expand on the research, we have clinical trials, and we are actually opening a trial maybe in the next 1 month in the first line stage 4 lung cancer, where I'm leading the trial, where you combine chemotherapy with 2 immunotherapies, not 1, with 2 versus the standard of care, just to see if it improves the outcome for our patients. With that, I'm gonna leave it on. You tell me, thank you very much for your time. I keep it brief, but I'm open for all questions so we can have more of an interaction and a dialogue. Dietary habits do change. There are no certain diet that is like, it says increases the risk of cancer, but there are certain diets which helps you, like Mediterranean food. So including 5 servings of fruits and vegetables. Jodi apni 5 serving of fruits and vegetables on a daily basis khan, it reduces the risk of having cancer in general. Yes. 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 How long did you smoke for? How many years did আপনি কত বছর smoke করেছিলেন? Yeah. So your risk is still high, but if you go back to the slide, George, it's down, but it's not 0%, but it's substantially decreased. I mean, অনেক কম হয়ে গেছে, but it's not like, yeah, that one. But it's not like 0. But yeah, no. But it's very substantially decreased because আপনার 25 বছর হয়ে গেছে, right? That's what you said? So if you look at that, right. So if you look at that, it's just, it decreases dramatically. But it's not 0. You will not qualify for the screening unless until you have other reasons because your risk is so low, which is good.
You have a chance to get it, right?
Always have a chance. I don't know the answer for that. I wish I could say it always goes to 0, but it does not. It's not. Yes. Yes, sir.
I have a long history smoking. I started in 1971 and quit 1994. How do you evaluate that?
Oh, it's already 30 years, right? So your risk is almost 0, but not 0. They will not approve your CAT scan because the risk is so minimal that the benefit of getting that. But let's say what you need to be worried about, আপনাকে কি যদি আপনার কোনো symptoms থাকে, like extra smoking, you have new basic shortness of breath হয়ে যায়, আপনি কাজ করতে পারছেন না, আপনার কোনো mucus আসছে, which is new, then you get an X-ray, you talk to your doc, and then we can obviously get a CAT scan. But there's no benefit of doing a CAT scan as such, just on your case. Anyone else? Yes, sir. Great question. So the screening is completely a different kind of, it's a low dose CT scan, so you don't get a lot of radiation. It's without contrast, so you don't get that. If you have had a CAT scan in the last 1 year, jodi ek bochore bhetore ek kono CAT scan hoyeche for whatever reason, then you do not qualify for that because it's already picked up. This is only jodi apni kokono CAT scan korenni or ota you have fit in that criteria. So yes, but it's a lower dose CT scan. It's not as high risk for when you're looking for something else like pneumonias or blood clots. It's completely different CAT scan. So yes. Yeah, so ideally you should do it for 3 years. But then depending on the risk factor, if the patient continues smoking, you could apply. But the guidelines are for at least for the next 3 years, annually for 3 years. And if they pick up anything, right, so then you follow along. There is a Fleischner criteria which we use in radiology and oncology, and they just follow along. Good. So in the slide of the risk factors, I did show you that kind of exposure can increase the risk for having lung disease, not just cancer, but heart disease, lung disease, and all of that. It's unfortunate, like miners, welders, they do have a slight, if you don't take the necessary precautions, then the risk increases. So if you see occupation, miners, heavy metal workers, they do have a slightly increased risk of lung cancer, correct? And other disease as well. I'm glad you're doing well. So family history jodi kono genetic mutations body te thake, like some patients have some mutations jade you can give it to your offspring, mane chele me jade, it doesn't happen right away, eta shomay lage to have a second hit, and that's what causes the that's what increases the risk of lung cancer. Jodi apnar family te baba ke hoyeche, grandfather ke hoyeche, or uncle ke hoyeche, and then it happened, and then when the kid grows up, like say 20, and starts smoking, that risk just goes higher and higher. That's what it becomes. There are no specific mutations which we can say it's absolutely related. Amra jani ke for some ethnic race, the risk are slightly higher. So like for Ashkenazi Jewish patients, they have a slightly higher risk of having some genetic mutation bhetore body te jader or risk of having lung cancer and other cancers go up.
What I was going to is that if somebody's father has lung cancer, it automatically doesn't say that this is a cancer.
That is correct. Jodi keo, yeah, Jodi kya ke like ache ora smoke kore 80% risk of having smoke. That does not mean that chele me ke hobe. That's correct. What's that?
There is a possibility, not
That-
necessarily.
Oh yeah, it's a remote possibility. If you live a good healthy lifestyle, it's a remote possibility. If you reduce smoking rates, then it becomes better. Thanks, Doc. Anyone else? Think we're good? Oh yeah, and that's my information if anybody needs. As me. A younger me. Younger me, not me. A photo, I think it's 4 years younger, so yes.
That's in college?
That's not in college. That's 5 years, yes. You know how they make the photo look better? So yes. But that's all the information with our site and the phone numbers. Instead of giving cards nowadays, we go all virtual. So actually, hopefully that helps.
What is the difference between pancreas and lung cancer? Pancreas is in the stomach,
Yes.
and lung cancer.
Yes, lungs are here, yes. Completely different, onek different. I mean, that's a whole different bad idea. So, and we do treat a lot of pancreatic cancer. Amra onek cancer treat kori. We also have same clinical trials, research, but yes, different.
My doctor was Dr. Sunil Patel in Northwest.
I know.
You know him?
Oh yes, yes, we know him very well. So we are local here. Amra ekhane local. As I said, I'm Bangla and Hindi. I'm not Bengali, but I can speak, a little bit Bengali and Hindi and Punjabi and English, all of that.
Doctor,
Yes,
thank you. Thank you for coming and
of course.
we often know that lung cancer is related to smoking, so I think, majority of people know this. But, recently we're having, like stomach cancer, you can name it differently. Like recently I lost a nephew, about 30 years, and he never smoked or never, the stomach has nothing to do with smoke.
Well, so smoking does increase the risk of stomach cancer, but there are way many different reasons for having stomach cancer.
Any sort of sign or anything, you just found out in 3 months and it's gone in 3 months. And, I have another gentleman, saying, they could not find out why it's some.
So when you say that, if you jodi apni 30 bochor apnake not you but like apnar friend or family member jodi tini 30 bochor or tini ke stomach cancer hoye geche without any risk factor, that means there is a very high risk that something genetics ache mane apnar family te genes ache. So we do amra genetic counseling kori mane amader genetic counselor ache, they need to get tested. Well, unfortunately we could not help him, right? Amra tini ke help korte parlam na, but they have family members. So that their family needs to be tested for genetic mutations. I can name so many mutations which can run in family and predispose other family members to get the cancer. So jai diagnosis hoyeche apni oncologist na hole apnar primary doctor ke bolte paren genetic counseling korar jonne. Those are very important patients because you have to pick up the reason, because it can affect many family members. And আমাদের এখানে ক্যান্সার ইনস্টিটিউটে ভেরি রোবাস্ট জেনেটিক প্রোগ্রাম আছে যারা আমরা হেল্প করতে পারি টু পিক আপ সাচ থিংস
Speaking of that, he lost a cousin a year ago. They could not, they could not find out the reason. He was fairly young guy, about
Yeah.
45 years old. And then his cousin, who's 30 years old, and he's gone in like 3 months.
Well, the gone in 3 months is different, but why having cancer?
He had no sort of sign, no issue at all. They found out in 3 months.
But that's what I'm saying. Maybe he has kids, or maybe they need brother, sister, father, mother. He's a young guy. They need to get a genetic screening done rapidly because that's where, যদি আপনার genetics positive থাকে, then আপনি family members কে বলতে পারেন that screening করুন, endoscopy করুন, CAT scan করুন, whatever needs to, so that you pick up it early because you may not have any signs of cancer or symptoms of cancer otherwise.
So you're saying if the family member have,
You have to check for genetic mutations. It would have been better যখন patient কে হয়েছে তিনি কে mutation check করে and then family members as well, but you should check the genetic.
so let's say I don't, in my family, I don't know of anyone having cancer. So can I still ask my,
So you can ask, that's where it becomes tricky with insurance coverage of whether the genetic consult will be covered or not, but it does not hurt to ask. এটা আপনার কি হবে ওরা না বলে দেবে কিন্তু আপনি যদি জিজ্ঞেসই করবেন না তাহলে you will never know the answer, right? So you have to, it does not hurt to ask that question. Good, so I convinced you that not to smoke or whoever smokes to quit. Right?
those who smoke are not in this room?
Oh, I got you. Well, I hope this message goes across. So, good. Any other questions or any comments? Anything? No. Okay.
Kids, you have anything?
Yes.
I know a person who is now running 89 years old.
What's that? Sorry.
I know a person who is now 89 years
89.
old.
Yes.
He has been smoking since
I knew this question was coming. I'm like, why is nobody asking me this question?
still he smokes.
Uh-huh.
Still
Uh-huh.
he doesn't have anything.
Yeah, and again, that doesn't mean anything that if everybody drinks alcohol, he's gonna get liver failure. Everybody's body is different. Every patient's pharmacogenomics, so that word is actually what you're asking me, is genomics. আপনার বডিতে আপনি বলবেন আমি তো শুধু 5 বছর স্মোক করেছিলাম আমি তো জানি 30 বছর স্মোক করছে কখনো ক্যান্সার হয়নি আমি তো 5 বছর that's nothing. Each patient is different. আর ওদের genetic makeup যা হয়, that's what Dr. Khan was trying to say, কি ওই family history riskটা কি আছে, that genetic makeup is completely different. I'm going to ask you a question. Do you know people who can drink 4 drinks? Like they can have 4 alcoholic drinks and nothing happens to them. They're like, oh, I'm fine, I can drive a car if I wanted to. Not advisable, but I'm just saying. And then people jara একটা drink করে and then they're like, oh my God, I'm thirsty, and they fall down, right? That's because their liver have different enzymes. Similarly, the risk factors for other things are different. And that's why it's hard to say this. Not every smoker will get cancer, but the risk increases dramatically. In
I have an example. My daughter-in-law, she's right now 39 years old. She did not have any corona vaccine. Everyone who took it, even the booster, till today, she didn't have it.
correct.
But she's working as a pharmacist. She was working.
Yeah, so again, each patient, when we do studies, যখন আমরা research করি, we take the whole population, and that's why even better to have trials to kind of pinpoint what the differences are. It's very different.
That's very interesting.
It is true. Yes, and even in ethnicities. We see this in our practice, যখন আমরা treatment দিই, dosing of the chemotherapy is also different. Jodi ami Asian patient versus Caucasian patient versus European patient versus Indian patient, the dosing and the side effects are different. And that's why we are doing research for doing all these ethnic minorities, because a lot of research comes out of the West. But we have to involve patients from everywhere to look at those differences.
So that depends on the immune capacity of the body.
There is much more than just the immune capacity. you know, there's a whole lot of things, but it does depend on your biological things. Yes, correct. Good. All right. I guess I'll give you 10 minutes back. But I'm here if you have any more questions. I'm sitting right here with you guys. All right. Thank you, guys.
We don't have enough knowledge to ask you one question.
Oh, you can ask me any questions. Whatever you feel about.
কথা বলার মতোই করি তাহলে ঠিক আছে? but it, it turns into a hall for wedding and stuff.
Very good, nice face. الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله